everyone, this is Rose and Meryl Bile, and now I'm going to share with you some of the questions and answer that I have encountered on the day of the exam of Caregiving Assessment NC2. So, on my previous videos, I have shared with you some of the questions. That is called part 1. So, you may search, you can search it on this channel, Journey Abroad. So, this is a wonderful opportunity to share the part 2 of our caregiving NC2 question. So now I'm going to start with the first question. So the first question is there a way to simulate laundry? So the answer is, before you wash your clothes, sort them by color and type of fabric. Then choose the water. Before you wash your clothes, sort them by color and type of fabric. Choose the settings for the water temperature, wash cycle, and load size that work best for your clothes. Pick the best cleanser for your wash load. So question number 2. What is the difference between dementia and amnesia? So the answer is, dementia is the general loss of higher brain functioning, while amnesia only affects the memory. So the third question, how can a person with Alzheimer's disease know the date and time? So the answer is, compose on the piece of paper about the day today. So next question, what is the best assistive gadgets for loss of motion? So the answer is a wheelchair. So the next question is, what is the normal blood pressure in adult versus an blood pressure on infant? The normal blood pressure in adult is between 90/60 and 120/80 millimeter of mercury, while in infant, the normal blood pressure is 64/41 millimeter of mercury. For a newborn, the normal blood pressure is 95/58 millimeter of mercury for 1 month to 2 years. Okay, so the next question is, what happens in cardiovascular failure? So the answer is, cardiovascular failure happens when the piece of the heart muscle doesn't get sufficient blood. And okay, the next question, what about the patient when he is hyperglycemic? So the answer is, chest pain, pressure, fullness, discomfort in other parts of the body, difficulty in breathing, dizziness, nausea, a cold sweat, or some of the symptoms. And having unnecessary appetite and thirst, quick heartbeat, and vision issues. So the next question is, what does splinting do? So a splinting device is to immobilize musculoskeletal bones, support mending, and to forestall further harm. So that's interesting. So the next question is, what is colonoscopy? So the colonoscopy is an examination of the large bowel and the distal portion of the small bowel with a fiber optic camera on the flexible tube passed through the anus is known as colonoscopy or coloscopy. So the next question is, how does proper dusting work? So The answer is using a dusting cloth and dusting each item individually. You should dust your furniture and the area around it. So the next question is, how Alzheimer's disease is caused? So the answer in this question is strange development of proteins in and around synapses. So the next question is, when the patient has paramnesia paralysis, what kind of aid is used? So the answer is a stretcher. So next question is, what causes cerebrovascular accident? Cerebrovascular accident, the answer is caused by a blood clot prevents oxygen and blood from reaching the brain due to smoking, diabetes, and high blood pressure. So, the last question is, what is the term for memory loss in a stroke victim? So, it is called aphasia, or a short-term memory loss. So, that's some of the questions that I've gathered in the past days. So I will try to take back on my notes, so I can provide you some of the questions that I have encountered on the next videos. So I will try to review my notes, and I hope I can gather all of it so I can help you to your next caregiving assessment. So that's it for that's a wonderful day, and have a blessed everyone, and thank you for listening, and don't forget to subscribe on Journey Abroad, and please comment on this comment section below, and hit the notification bell for more information. So thank you, and God bless. Bye.